Being a father and having a baby boy, all of these images start to float into your brain. Going to baseball practice, going to hockey practice, playing catch. That's tough. That's tough to have the images in your head and then somebody telling you it's most likely not going to happen. Reed was born January 3rd, 2017.
He did everything early. He walked and ran at 11 months old. He said dada since 6 months. He was always ahead of the curve. You teach him something once.
I'm in Boston. Where are you, in camp?
We started noticing some abnormalities. Just the way that his chest was, the way that his wrists, his neck, his bone structure. And then the endocrinologist, Dr. Babila, suggested we do a skeletal survey, which was an x-ray of every bone in the body.
Skeletal x-rays came back, and the results was indicative of mucopolysaccharidosis. I joined a Morkio Facebook group, and I saw some people were posting about Dr. Tamatsu was funding an NIH study for Morkio. And we started setting up plans to go to Delaware.
Morkio is inherited genetic disorders. Around 1 out of 250,000 births. Around 400 through 500 patients here in the United States.
Morkio syndrome is one in which an enzyme deficiency results in the incomplete breakdown of cellular byproducts. And these byproducts accumulate as our patients get older, and that can cause changes throughout the body. It causes abnormalities in how bones form and calcify.
Really funny.
You can see a protrusion of the chest. Forehead is prominent. Also with short stature.
After you see a Morkio textbook patient, and then you see your child, sometimes it's all you see, which is really challenging.
Morkio type A is, generally speaking, more severe in clinical phenotype than Morkio B, which is a more progressive disorder.
Like 90% have Morkio A, which is treatable with ERT, the enzyme replacement therapy, but 10% have Morkio B with no treatment.
When he first got diagnosed and we heard about ERT, we were pretty excited. We're like, okay, there's a treatment for this.
Right.
However, the treatment for it isn't a cure.
Enzyme replacement therapy is phenomenal for delaying the progression of some of the manifestations of Morkio syndrome. Unfortunately, it does not have a noticeable impact on the orthopedic pathology, specifically the spine deformity and lower extremity differences, including angular deformity and hip dysplasia.
Most people will say that access, when you place the needle in the port, will get easier, and we're like 2.5 years out, and he's crying and flipping out and delaying every time.
One. Done very good. Good job, buddy. Well done. You did it, baby.
We were talking about maybe him and I doing the treatment, but after doing it once, he wouldn't look at me for a week, Reed. So sometimes you just have to be mom.
But I remember the nurse telling us, you guys are mom and dad. You want him to associate you supporting him during this with you and not you causing this. So that was important. Reed gets a lot of attention. During infusion, all eyes are on Reed, but we always have to remember, there's Ruby over there, She's doing God knows what And, we're trying to make sure that Reed's okay during this whole thing.
We make a lot of time to make her have special things.
Oh my God.
But she does get jealous some days on infusion. She's like extra clingy.
Most kids with Morquio syndrome eventually have to go through some type of surgery.
Dr. McKenzie would like to do hip surgery.
Providing them with straight legs and well-covered hips helps provide pain relief and keeps our patients from relying on wheelchairs and other aids.
These kids have these surgeries multiple times. You can't really ever feel like you're out of the woods, and I want to feel like I'm out of the woods.
Apart from bone surgery, they may need tonsillectomy, adenoidectomy. That's also very common for Morquio, especially between 2 to 10 years old.
Every 6 months is ear, nose, and throat, and cardio, and neuro, and ophthalmology, and audiology. There are some orthopedics that just do like extremities and hips and back, and these are all appointments. And as soon as you get over the hump, it's another 6 months, and you've got to do them again. And it's not a one-man job, and it often is for one of us. One of us is at work always, and one of us is with the kids. Since Reed's born, so 5 years of opposite schedules. No one can afford $500,000 a year, at bare minimum. There's a lot of end-of-life planning that we're considering, which we should not have to consider for a 5-year-old. You feel helpless because you cannot help your child, but you can help everybody else. 2 years later, I'm still trying to wrap my head around that.
There's a very high burden on our families. Parents being out of work need to focus on the child who's a patient and how to care for the other siblings, how to travel to our visits. All those things require time, they require extra financial support, and it's incredibly costly. Our patients with Morquio syndrome are certainly some of our biggest characters in the clinic.
We're getting married.
We're getting married? When are we going to get married? Now?
They're the ones who have the nurses laughing or engaged.
Hexagon.
Yes, it does. It is a hexagon.
How did you know that?
How many sides?
6.
Uniformly, they do very well and they push themselves. It's undeniable. We see it in so many of our patients.
If Reed's happy doing what he likes to do, and if Reed's happy doing that, if he wants to play the drums as loud as he can for 5 hours, so be it. When something like this happens to a family, it could break them pretty easily. It could break them or make them stronger.
I think we are all optimistic that we are going to see improved options for treatment for these patients in the future. Wherever we are going with the treatment of Morquio syndrome, helping support them and keep that community strong is what's going to help us continue to make progress over time.
That's one of the amazing things that come from this, is the support from other people. Rally for Reed was originally founded by the wives and girlfriends of our friends. They felt the need to support us by having this fundraiser for Reed, spreading awareness for Morquio, and just doing their part and doing what they can to help out. I don't think that we would have ever been this close to the people that have supported us without Reed. And that's what's most important. That's what's gonna make him better and live a fulfilling and happy life.
Rally for Reed!
Alright, turn around. Walk regular, okay? I love you, Reed.
You want to pick out some stickers for your brother? You can have one too.
Under the sea.
All right. Now you're gonna hit it. Nice.
Watch your feet. Watch his feet.
We do 1, 2, 3 stands. All the way up. Good job. 2 and sit. Oh, you see it?
Are you standing
Yes.
on your own?
Yes.
Good job. Good job. Show me how strong you are. I need those muscles. Let me see.
Do you want to kick that? Go bam. Oh yeah. Going this way. Whoa. Better make it in. All the way, all the way, all the way, all the way.
I'm bougie, right? Oh, bougie. That's what she's saying? Bougie?
No booby. Not booby.
She did say. But he calls her bougie. Maybe pinata.
Mommy, look my unicorn. Ow.
Nice job, bud.
That hurts so bad.
I'm sorry.
Still hurt. I'm sorry.